So the Johnson and Storm classification is stage 1 is no deformity. That is, the patient is having pain and tenosynovitis. The patient is able to do single heel raise and radiograph is normal. 2A is when there is a flat foot deformity with a flexible hind foot. Patient is not able to do a single heel raise but able to do a double heel raise, and there is mild sinus tarsi region pain. 2B is when there is forefoot abduction. Too many toe sign will be positive and there will be tenonavicular uncoverage. 2C is when there is forefoot abduction and supination. Stage 3 is when there is a hind foot rigid valgus deformity, and stage 4 is when there is deltoid compromise and there is a talar tilt. So simplifying it is 1 is no deformity, 2A is flexible deformity, 2B is forefoot abduction, 2C is forefoot abduction and supination, 3 is rigid hindfoot valgus, and 4 is when deltoid is insufficient. Regarding the treatment, I will always start with a conservative treatment, which can be insoles or arch support. Heel wedges can be used. In a more resistant foot, I can put a AFO for the patient for a while. In some cases, if the tendinopathy is not improving, we can do a debridement, and debridement if there is severe pain. In a flexible deformity, we can use orthotics or longitudinal arch support. We can use AFO. Moreover, if the flexible deformity, we can do MRI confirming the findings and do FDL to navicular transfers plus minus 10 to Achilles lengthening. In more resistant cases, we can add medializing calcaneal osteotomy. The order of correction is that while going for surgical intervention, I will do a 10 to Achilles lengthening depending on the silver squared test. Then I will do a medial opening lateral cancalian osteotomy. I can also do arthroeresis, which is sinus tarsi implant in the subtalar joint. I may also need to have tibial posterior reconstruction or FDL transfer. I may need to have reconstruction of spring ligament. It's possible to do a medial opening wedge cuneiform osteotomy, which is called cotton osteotomy, or a lateral column lengthening osteotomy, which is called Evans osteotomy. In the rigid deformity, I can do a triple arthrodesis that consists of subtalar, calcaneocuboid, and talonavicular joint, along with tendo-Achilles lengthening and deltoid ligament reconstruction. In severe ankle arthritis, I can go on for triple arthrodesis with total ankle replacement surgery, which is good for patients with more than 60 years of age, good neurovascular status, no diabetes mellitus, and without severe ankle valgus deformity of 15 degrees. I can also do hindfoot arthrodesis if required.